start trying to have kids 5-10 years later. And so it's I think there's a really a direct cause to, and now I think there's a slight elevation in infertility, but the bigger issue is, hypothyroidism.
Can I ask you a question on hypothyroidism?
Yeah.
Take birth control out of it. When would you typically see hypothyroidism show itself in a patient that's not on birth control? Like, why does that end up happening to someone?
Yeah. So
without birth control, like, it just like, and at what age does it typically present?
Yeah. So let me hit on the Eastern and then the Western perspective. Okay. So one, it should never happen, but two, hypothyroidism in Chinese medicine is known as a qi and yang deficiency. Now, what qi is, if we now translate that into Western medicine, is basically your adrenal energy, your body's battery. So if your body starts producing, if your body gets in a high stress state and produces too much cortisol and stress hormones, over time, imagine your body like a battery on your phone. It starts to get lower and lower and lower. When that battery gets too low, that's part of what supplies energy to everything else in your body. So if that battery gets too low, your body is smart. It says to itself, I don't have enough supply here to create a new human being. And so that's one of the biggest limiting factors. And so qi in Chinese medicine is really connected to those adrenals and also your cellular energy, your body's ability to create ATP. The other thing, though, is it's connected to yang, and that's your body's ability to, yang is being anabolic. So we think about anabolic steroids. It's your body's ability to regenerate and grow and heal more quickly. And so women that have hypothyroidism have low qi and low yang. Now, there are a lot of herbal prescriptions for this. In fact, ashwagandha is known as a qi and yang booster. Cordyceps, rhodiola rosea, ginseng for men, dong quai for women. Those are some of those sort of quintessential herbs that have been used throughout history. And women that have hypothyroidism will tend to know, by the way, the amount of women that have hypothyroidism and don't realize it is like 60%. So there are millions of women who have hypothyroidism and they don't realize they have it.
So if you had a client that had hypothyroidism, would you first tell them to take all those herbs, or would you immediately prescribe a synthetic what's a pig what?
It's pig thyroid tissue.
Pig thyroid.
And so it's T3 and T4. It's called Armor.
Yes.
And there are a few other brands there too. So here's what I would do and recommend. I would recommend, and by the way, I don't have a license to prescribe drugs, so I only recommend herbs and vitamins and all those things. But let me tell you exactly what I would do if somebody is hypothyroid. I would first address, we need to address cortisol, okay? And there are lifestyle factors there. So we got to get that battery back charged up. Acupuncture is great for that. Doing things that just are not busy, where you're not trying to get ahead. Reading a novel, lunch with a best friend, walking in nature. Again, just having real downtime to recharge your batteries, that is essential. And then good sleep. I'd get an Oura Ring or Whoop or whatever sort of tracker. I would try and get a sleep score in the 80s and 90s as often as possible. I would then go and take certain vitamins. So I mentioned this before. Most women with hypothyroidism, many of them have methylation issues, and which basically means that they're not converting the B vitamins in their body to the factors that then your cells and organs use. So they're not converting those properly.
So would you take like a methylated B vitamin?
Exactly. Okay. I would take a methylated B vitamin supplement, probably a higher dose than most people think though. I'd probably do I would do it twice a day, the normal. It's hard for me to say it because I need to know the brand, but my point is I would probably do a serving twice a day.
Assuming, and this is broadly. This is not, obviously each person's individual.
Yeah. Again, I would really look at selenium. I'd consider vitamin D as well. And so I would really make sure I cover those nutritional bases. From a dietary standpoint, now this is big. This is where a lot of women mess up with hypothyroid. Your body is cold with hypothyroidism. You have a yang deficiency. You need to consume foods that are anabolic and warming. And so that's going to be red meat. Lots of cooked red meat. It's wild salmon, it's chicken too, but it's those foods that are anabolic. It's going to be, you don't want to do salads. You don't want to do vegetable juices. You don't want to do ice cold smoothies. You want to do things that are warming, soups and stews and those sort of foods. You want to be doing sweet potato and rice as those sort of carbohydrates. You want to be doing fenugreek and cinnamon.
Is cold plunge bad?
If I have a patient with hypothyroidism, I recommend they do. If they're going to cold plunge, once a week, a short time, but ideally it's either 0 days a week or 1 day a week for 3 minutes, and that's it. I would much prefer them do infrared sauna and a lot of infrared sauna because we want to, think about this. the body temperature's in, let's call it 97 something. When the body temperature's low, that's the biggest sign, one of the biggest signs of hypothyroidism. We really need to warm the body internally. And so those infrared light panels are great because it starts to drive heat deeper into your tissues. And that's more of what you want to try and do for that.
And it's funny doing this podcast and speaking on this subject before, like there have been many women that have written in with this issue, and we know some as well. I'm not trying to put a blanket statement on everyone, but I think there's maybe a light bulb moment here where a lot of the people that we've talked to have a diet that you described, which is a lot of cold foods, a lot of salads, a lot of smoothies, a lot of very little red meat. And when we moved to Texas, Lauren kind of, that's how you used to eat in LA. Now you switch, you're eating a bunch of red meat. And I think like a lot of the issue is resolved, but you've switched up a lot of the diet that you
I
used
eat so much red meat.
But it's interesting that you mentioned that because I've never heard anyone say that.
I eat red meat every single day.
Perfect. I mean, I'm a big believer in a personalized diet. Everyone is unique. I mean, some people can do what, you know, here's what happens with most physicians. They adopt and they're like, you know, you have a physician and they're like, everyone should do paleo or everyone should do keto or everyone should be vegan. And when you go back and study these ancient forms of medicine, no, everything is personalized. Nobody should be eating the exact same diet hardly. Now, maybe people with hypothyroidism, most of them, there's a lot of overlapping foods, but people need to eat foods that are right for them. Like I learned this in practice. If I had somebody come in with inflammatory bowel disease like IBS with diarrhea, if I would have them eat raw vegetables, it would wreck their system. So I would never do that. I'd have them eat a lot of soups. However, if I have someone coming with cancer, most types of cancer, I'm going to have them do some raw veggie juices, maybe some salads, some things like that, because we really are focusing more on healing the liver and the lymphatics and some of those areas that may tolerate raw foods, whereas the gut and GI, if you got inflammatory bowel disease, that would wreck you. So it's not that I don't think that salads and veggie juices and those things can be healthy, but for some people, they're going to be poison. For some people, they're going to be, you know, liquid gold. It just depends.